Welcome back on the AM show from Wajagba, where we come back into the studio. And we're going to be talking about health, your health, my health. Well, the Kedar Health and Wellness Center. This company provides a wide range, an array of natural health foods, products, and services such as naturopathic wellness consultations, detox solutions, wellness therapies, pranic or energy medicine therapeutic massages, natural beauty products, and coaching sessions. Well, to tell us a bit more about this group, we have Christine Chum, founder and CEO, Kedar Health and Wellness Center. She says I should refer to her more as an alternative doctor and pharmacist. Well, Christine, good morning.
Good morning.
Welcome aboard.
Thank you so much. Thank you for having me.
So I've read quite a bit about you. You are a transformational health and wellness coach, an American board-certified NLP life coach with a specialized, I got interested in this, grief coaching program. And you're an energy healer. Yeah. I guess that's where the pranic comes in, right?
That's it.
Tell us a bit about what you do, even before we get into why you set up the Kedar Health and Wellness Center.
Okay, so for us, it's just providing a holistic solution in a natural way, right, for our clients. So holistic, it has physical, mental, emotional. So that is why it's the food, it's the services, it's the energy, it's the coaching, all right? All together giving that holistic view. Should I say?
That all-round...
360 degree, all right? Because when you're aligned in all three, that's where your healing begins.
I see. Mentally, physically,
mental,
everything.
Physical. I'll give you an example. You know, sometimes emotional problems cause physical symptoms.
Yeah.
Okay.
I agree.
Yeah.
We all get to that point.
We'll get to that point in that. So let's say two people, Mary and Jane, walk into a pharmacy. They both have headaches. Okay. They walked in and they want paracetamol. Right. Mary's headache is from an actual illness. Maybe she's got malaria and it's giving her the headache. If I give her that paracetamol, she'll be fine. Jane's headache is because her husband is having an affair. No amount of paracetamol is going to solve that problem. I need to deal with that bit of it. So that's where the coaching comes in. That's where the mental, emotional issues come in. All right. So when we deal with that, then the physical symptoms go.
Interesting perspective.
Yes.
Interesting. Same problem, different solutions.
Same problem. So we want to get to the root of the problem.
Why did you set up the Kedar Health and Wellness Center?
As a pharmacist, I actually wanted to impact my community in a different way. Right? I wanted to provide a natural solution to wellness. So we are going to eat anyway. Food is actually your medicine. If you look at most drugs, they originated from plants and herbs. Yeah. Okay. So you eat
Most
anyway.
Of them have organic components.
Exactly.
Also the synthetic.
Exactly. So you eat anyway. So why don't we just eat the foods that will make us healthy, that will boost our immunity, that will help us prevent disease? Okay. So that's the premise of it, because food is your medicine, and medicine really is your food.
And speaking of our food being our medicine, I just want us to maybe not digress, but looking at what we eat in this part of the world, especially in this part of the continent, we're heavy on carb-filled foods.
Absolutely.
Whether you're picking the banku, fufu, kukunte, even the kukunte, there's a bit of drying. I mean, or the rice, I'm heavy on rice. Or all those components, there's a lot of carb, among others. When you look at our eating habits...
You just hit the nail. I was going to say that, in West Africa, we're the largest consumer of carbohydrates in the world.
West Africa.
I
didn't know that.
And just as you've said, all the food that you've mentioned just the carbs. If I ask you what you're going to eat this afternoon, what would you tell me? What would you
I just had carbs this morning.
What was it?
Rice.
So
Rice.
That's what people say. You ask what they're going to eat. They'll say, I'm going to eat rice. I'm eating banku. I'm eating kinki. I'm eating ampesier. They always start with the carbs, right? The trick, our bodies are a machine. Yeah. God in his wisdom made us the best machine ever. Everything works as it should. So just like a car, that's also a machine. You wouldn't put diesel in a petrol car, would
Nope.
you? Nor would you put petrol in a diesel car.
No.
You'd put the right fuel in your car. So we need to put the right fuel in our cars, our machine as well. So the trick is, and whenever I say this, people get a little, your portion size for your carbohydrate per meal should be the size of your fist.
Carb size for a meal should be the size of your own fist. So
The bigger you
if I'm
are,
going to have rice,
that's-
a cup this size.
That's your
it.
portion size. The bigger you are, the bigger your fist.
If I am to go by that, I've already eaten more than my fist size this morning.
But you're filling your plate. You're filling your plate with
Other components.
with vegetables.
Vegetables.
So when you take your plate, you divide that into two. One half should be either your fruits and vegetables. The other half of your plate, divide that into two as well. That quarter part up at the top, that's your carbs, your fist size, and the other part is your protein. So that's your guide for a healthy food plate. And you'd be surprised how full you'll be with all those vegetables.
I mean, that is true when you add other things. I added some spaghetti which had some veggies mixed with it and some protein. I admit I went a bit heavy on the protein this morning, which, of course, but I know it's my first meal of the day.
Right.
They say you eat like a king in the morning.
In the morning.
Sometimes I don't usually eat at this time of morning, but today take was going on. So I ate like a king
this morning.
I know
You
it's
eat
going
like a
to
prince
take through the day to digest and everything. So my other meals are probably going to be much smaller. Maybe have some fruits in there. And we're good to go.
So the trick is also always have your fruits in the morning. Always eat your fruits first. Fruits digest very quickly. 30 minutes, your fruits have digested.
Right.
Your main meal, a meal with carbohydrates and protein, would take 12 to 18 hours to digest. The mechanism of digestion is your food needs to break down, isn't it? Basically, you break down for you to absorb the nutrients and nutrition that you need. So if you have a heavy meal, a big one that's going to digest in 18 hours, and you put fruit on top, that will digest in 30 minutes. The fruit is going to break down on top of the other one.
Right.
You're going to get gassy. You're going to get bloated. You're going to feel uncomfortable. All right. So you must always do fruits
you want
first.
to do the fruits first.
First, let that digest.
Comes on top,
there you go.
It helps.
The fruit will have digested already. So usually doing fruit as dessert is usually not
But
a
that's
good thing
what
to
we've
do.
done for donkey years
Yes,
in Ghana, elsewhere in the world. Same thing. You have those things afterwards. They still help. I mean, when you take them, they still help with your bowel movements and all of that. They still do, don't they?
They do. But the whole point is when you have this theory, all right, when you have this knowledge, you know that, okay, but try it and see.
I've done it before.
Put fruit and just see how you feel, all right, because it's so uncomfortable, all right, and you get really bloated. So you want to help your digestion process because the main reason why we eat is for nutrition.
Right.
You're feeding your body. You're putting that fuel in your body. So for every meal, ask yourself, is this food healing me or it's killing me?
Okay. Later, I'll throw something, I'll fling, not a hot potato, but something interesting at you that I found out recently. But let's get back, let's touch base. So basically, we are what we eat.
We are what we eat.
And we should be very careful what we put into our systems.
Absolutely.
Like you said, you wouldn't put petrol into a diesel engine or vice
versa.
All right. So what do you want to achieve at the center for your clients?
All right. For our individual clients, it's optimum health. As I said before, it's making sure that you are physically, mentally, and emotionally aligned. When we have all three, right, that's where your healing begins. You want optimum health. For our corporate clients, we want to increase your productivity because 50% of absenteeism at work is usually due to illness and sickness and people out of the office, right? So we do a lot of corporate wellness training for staff and employees. So we teach them and help them make sure that they are at optimum health because then it gives you more focus, more energy, more clarity, you work better. Productivity in the company increases. You're not paying that much money for medical bills, for your staff out of the office, and medication, right? So that's what we want to do for everybody. Optimum health.
And as a follow-up, I would like to find out, what are your product and service offerings then? I mean, apart from what you've already told me. So your products, your services, what do you have on offer?
Okay, because you are what you eat, the first thing is we want to make sure you're eating the right things. So we have a health food store, okay, natural foods, natural skincare, plant-based supplements. And then we do the consultations, the diagnostic scans, the detoxes, the weight loss programs, your stress management. Stress. So we do a lot of therapeutic massage, pain management, and of course the life coaching with the energy medicine.
Okay, so you talk about life coaching. Let's talk about that a bit. How does this coaching bit help with your health and wellness, so to speak?
Yes.
How does coaching, basically coaching, is it equal to health and wellness? How?
Because you want to find the root. You want to go down to the root of the problem. Emotional, mental issues sometimes give you physical symptoms. So when we dig deep and we're able to sort out that mental and emotional aspect of your well-being, most of the time physical symptoms disappear. Okay? And it's also the same for the energy medicine. We all have an aura. We all have an aura.
I hear the pranic coming out.
Yes, we all have an aura. So sometimes we deal with the energy, your energy body, to deal with physical symptoms. Okay. So together, right, we want to be able to deal with the root cause of your problems, right, and make sure we want everybody to be healthy and fit. You always want to be the best version of you. That's what we are aiming for. The best version of you.
Oh yeah, the best version. Some of us, we want to be here till this body must,
I said I'm going to live.
Simple. It must be here for a long
I'm going to live to 120. That's what I'm saying.
Oh, how come?
Oh, I want
a
120.
shared. No, because I want to do 122.
Oh, really?
Yes, that's my magic number.
Same here.
I'm surprised.
We'll be dancing at 120 then.
I'll see you at 120. I'll see you at 120. This message comes through. It's from Kwabena Asante. He says, "It's good you're showing this program. Thank you, joining you. It's a very good morning to you." Okay, so thank you very much, and we're glad we're doing this because of you, of course, and so you know where to go to get the best for yourself by way of health. What I said I wanted to run by you.
Yeah.
I don't know whether you've heard of Rishi Sunak's 36-hour fast. He does a 36-hour fast. I was just reading about it yesterday, from somewhere on Sunday to sometime on Tuesday. And he's just taking tea and drinking water to keep hydrated and all of that. Some say there are two different ways. You eat, and of course, sometimes your body, your digestive processes give you the nutrients and everything, but there's also a way where it can do different things. In other words, it can go after, when you go through such a fast, instead of now it depletes the store of fat or whatever food, and now it goes on the fat, okay? It starts breaking that down, of course. That would also give you a flatter tummy and all of that. But some have also questioned the health of it. I just wanted to run it by you. I know I'm throwing a hot potato at you.
No,
what
it's
do you
okay.
think?
It's okay. That process is called autophagy, where you don't have a lot of
Autophagy,
stuff. You don't have a lot of food in it, so your body starts working on its own. Whenever you fast, you're just giving your body a chance to clear your digestive system. Give your digestion a little break, okay? The 36-hour, it's okay because he's still drinking teas and stuff like that. If he's doing the herbal teas, he's still going to get the nutrition he needs. But you're giving your body a break, all right? I know about it.
But your energy levels won't be the same.
I'll tell you something. There are times when I do what I call a 7-day raw food diet. For 7 days, I don't eat anything that is cooked. Okay? What that does is that because the food is raw, all I'm getting is maximum nutrition. Whenever you cook food, it's going to break down. It takes away part of it. So if everybody can do even just one meal a day that is raw, okay, you're going to get, so it's once a week, isn't it? But 52 days of really good, nutritious food. And a lot of people ask, oh, Christine, what am I going to eat that's raw? Your fresh juices are raw. Your fruits are raw. A salad is usually raw. Even when you do a smoothie, you're putting a lot of raw ingredients in and just blending and drinking it.
Funny,
Okay.
I like taking, you know those, I've forgotten the name. You see those tomatoes,
The cherry tomatoes.
cherry tomatoes?
Yes.
I eat them raw.
That's
I love
it.
tomatoes, by the way.
And it's really good for
a
your
lot of-
prostate.
Yeah, so I hear.
Yep.
So I hear.
Yep.
So here
Yep.
we go.
Yep.
No
There you
wonder
go.
the last time I went, they said my prostate was in tip-top shape.
You see, it's fantastic for prostate, you know.
I see.
So it's just same thing. The thought process should be, what is this food doing for me? Right? Just be conscious of what you're putting in your body, right? Because you just want fuel. You want to fuel your body. You want the best nutrition possible. That's what we
So,
want.
Kedar Health and Wellness Center.
Yep.
Before you, I don't know whether you have any other comments before you tell us about where you're available online and how people can reach out to you. What else should our viewers know?
Also, try and eat by color. For every meal, by color. Different colored foods give you different kinds of nutrition. They help in different ways.
Okay, so the greens will give
So
you
your
something, the
greens
red,
will
yellow.
give you, your greens are going to help with your bones. Calcium, lots of strong bones, greens. Your reds are good for your heart. Your tomatoes, your watermelons. Yeah.
The red pepper as well?
The red peppers, all your red foods.
bell peppers and-
The bell peppers, your actual chili peppers as well. Or your red foods are good for your heart. Your orange foods are good for your eyes. Your yellow foods boost your immunity. Okay? Your white foods help to fight disease, lower blood pressure. Okay? So for every meal, put at least 2 colors on your plate.
Here we go, color coding.
There you
Let's
go.
Color code our food. Let's color code our food.
Okay.
Okay. I mean, we've been eating them without knowing about all this
There you
color
go.
coding.
Yeah. But a lot of times, people, if you look at your plate, it's usually one color: jollof and chicken. Brown. Put some color in there. Yes, lots of nutrition. For
Spice it up.
Yeah,
It's been an interesting conversation.
fantastic.
How do people reach out to you?
Okay. We are located not far from Joy FM. So all Joy FM, you have no excuse, right? We're just down the road, Fanafa Road, number 7 Fanafa Road. We're available online, and it's so easy for people. We want to make it easy for you to be able to get the best food to eat. So online at www.kedarhealth.com, because we deliver all around Ghana and internationally around the world. Okay. Telephone numbers 050 133 7836.
One more time.
050 133 7836.
Okie doke. So make your way here, Fanofa Street. It means I think I've spotted you before. Now it comes to mind.
Yep,
And I should swing by someday.
you should.
I'm sure I'd get a good package. But make your way to them. And of course, your health is your wealth. If your health goes south, your wealth of whatever nature will also go south. And I'm going to pronounce it the way she did. You know, around these parts, you pronounce certain things and they say, no, it must be. So, Kedar Health and Wellness Center. And of course, we hosted Christine Chum. She is founder and CEO. And of course, she also is an alternative doctor and pharmacist. Thank you, Christine, for joining the conversation. Stay with us on the AM show. There's still a bit more time, and we're going to be engaging you on your thoughts. Today, we've been to Wejagbawe, AM on wheels, and the people were complaining in the Gbawe area, the roads and some of the things. But if you're in that area, you can reach out to us. We also had that conversation on health and why most of our health facilities lack even the basics. Can you imagine? These pharmacies and the rest in our health facilities, only about 10% have thermometers. We are not even talking ventilators and defibrillators, thermometers. Share your thoughts with us when we return after the break.